It's one of the most talked about movies of the holiday season, Concussion, starring Will Smith, opens on Christmas and focuses on the NFL and how they have dealt with concussions over the years. Now, our sponsor, Virtua, has decided to help answer your questions about concussions in an event happening in just a couple of weeks. Sports on the Brain will take place December 10th. Here to talk about concussions and the event is Dr. Trina Lisko from our sponsor, Virtua. She is a concussion specialist. So, Doc, let's talk about the impact that this movie could have, because it's already gotten a ton of buzz already.
Absolutely. Well, as with the concussions being just more prominent now, and we're trying to make much more awareness to the public and allow them to have a venue to ask questions, this movie is just going to bring the awareness out to even a greater span of people who may not even still realize what's going on in the sports medicine world, and you know what a problem this is right now, just because we don't have all the answers just yet, not just even the short term, but the long term maintenance of these injuries. Well,
you are a concussion specialist. I'm sure you have folks who are adults or even parents or whatever that come to you. How in the dark are we still when it comes to this?
We're still pretty far away from having all of the answers. We don't have a lot of great research yet in terms of, you know, what happens with 1 concussion, 2 concussions, 3 concussions, or is it all concussions or those what we call the subconcussive hits.
Now, what is that?
So these are hits that an athlete might sustain that don't necessarily cause a concussion or symptoms related to it, but in the long term could have ramifications, just like historically what you would call punch drunk.
So this is typically after the first one or after they've had multiple? Or
they don't even have to be diagnosed with a concussion at all. And we still don't know if this all plays into the long-term ramifications, but it's kind of where the research is going and looking into right now.
Interesting. Now, the one thing I think is really, really difficult on the doctors and even the independent doctors, the team doctors, whomever, and we had the case with Malcolm Jenkins, where he was concussed. He later on admitted it happened, you know, in the second quarter. But he kept playing because he didn't tell anybody. Now, he didn't show the outward symptoms, you know, right away, which is really hard, even if you try to put all these things in place for these guys.
It is hard, especially for the sideline evaluations, the spotters, the athletic trainers, the coaches, and the physicians on the sideline, because you don't actually even have to sustain a hit to the head to have a concussion. You can get hit to the body, the neck, the face, anywhere, as long as there's an impulse force transmitted to the head. So what we're all looking for as a hard hit to the head may not be the result of the concussion.
You're right, because we always think in those terms, oh, we didn't get hit in the head. Well, that doesn't matter.
It doesn't matter. You don't have to get hit to the head. And then, therefore, it's not even the amount of force that the hit is. It could cause like an acceleration, deceleration that's transmitted to the head. So if you watch a game, sometimes the hardest hits that you see aren't ones that are sustained in a concussion, but sometimes it's the lighter hits that you see, and then all of a sudden the player will get up and they look a little wobbly. So it's hard to gauge on how hard is a hit that you need to check that player. And these are the things that we're all still trying to figure out and hammer down, so we have good data to then be able to evaluate the players on the sideline.
And here's where I think your event that you have coming up, Sports on the Brain, which is the Virtua Total Turf experience in Pittman, is going to be great, because you guys can educate folks that it's not always what we thought it was. It's not necessarily what the old stereotypes were of what a concussion is.
And we don't want athletes thinking that after they get a hit and they feel a little foggy that they can just shake it off and go back out there. We want to make sure that they're educated that these injuries potentially do have longer term ramifications if they're not treated appropriately, and that they're putting themselves at risk playing in this state. Their brain is vulnerable. We want to make sure it's protected. It's the only one that you get.
You're right about that.
So we want to make sure it lasts you the whole time.
All right, so just give us the details when this occurs and how people can get involved.
Yep, absolutely. The event is at Total Turf in Pittman. It's occurring on December 10th from 6 to 8 p.m. It's going to be a nice panel of basically a team that takes care of concussions, the athletic trainer, administrators, myself, and nutritionists. So we'll be able to answer any questions that anybody might have regarding concussion.
That's awesome. Looking forward to it. Dr. Trina Lisko, appreciate your couple minutes from our sponsor, Virtua.